Marwan Cameron, and this is the Conduit. All right, y'all. It is Monday, November 8th. It is 1 p.m. in Kitsap County, 52 degrees. And fall is here. There's so many leaves all over the place. Gonna have to bag them, but they're beautiful. Not really beautiful when they're wet, but they are beautiful. I love fall. It's my favorite season. But you know what time it is. It is Monday, and on Mondays, we have Kitsap Public Health that comes on to chat with us and give us some information. So today we have Nurse Lindsay with us again. So we're going to go ahead and bring her on in. Good morning, Lindsay. How are you doing today?
I'm doing great, Marwan. Nice to see you again.
Yeah, you as well. How was your weekend?
I had a nice weekend. Got a little rainy yesterday and a little wet out there, but it's this time of year. Daylight savings with kids is always interesting.
Well, you get to fall back, so that's awesome. What's so weird was I remembered that it was supposed to fall back, and then it happened, and I forgot. So I'm like looking, I'm in the bedroom, the clock is different, everything else auto set. I'm like, what time? Like, what's going on right now? I was like, oh, okay, I got it. So, I got an hour, and I didn't even realize it. But I had a pretty late Friday, so I actually needed that hour, and then I took my staff out to see the new Marvel movie on Saturday. So that was a lot of fun. So we enjoyed our weekend for sure.
Nice. Always good to get an extra hour.
I guess even if you don't know it, right?
Mm-hmm.
Well, let's get into today's show, and we know that the vaccine has passed its emergency authorization for kids 5 to 11, and we want to continue to educate the community on that. So I'm just going to kind of pass it to you and have you give us some information. Also, I didn't mention this beforehand, but it's always good to check out the Kitsap Public Health website. So and just kind of look at that graph so people are empowered to look for the information for themselves.
Yeah, definitely. Thanks. Great questions, Marwan. And pediatrics, it seems like, is on the forefront of a lot of people's mind right now because of the recent approval. Right before Halloween, the FDA came out and said they gave emergency use authorization for giving the pediatric Pfizer vaccine to the 5-year-old through 11-year-old crowd. By November 2nd, that went to the CDC, and they also gave their approval. So by the 3rd, that's last Wednesday, in Kitsap Public Health, we were delivering vaccine all over the county. And as soon as last Thursday, vaccine started to go into the arms of some of the kids in our own community. So, so far, so good, what we're hearing. A lot of really, at this point, it's some more eager getting in line first families that are getting their kids out there that weekend number 1, which just happened. But, hearing a lot about like tears of joy and just relief from parents, excitement from kids. They've heard this talked about for a long time. And overall, just a feeling of positivity. I know from us in public health, this is whenever we get a new approval of a way to stop or slow the spread of COVID, we're all pretty excited.
Well, that brings up a lot of questions now. So this is the first weekend, and as I said before, my daughter wanted me to lie about her age so she can get vaccinated early. What has been the experience from the kids? One, do you have any numbers on how many kids in the county have been vaccinated? And 2, what was their experience? Did they get sick? Is it kind of a range? What were their symptoms? What can you share with us?
Yeah, Marwan, I don't have a lot of data because since it just was so recent, we don't have the data points in, but I do just anecdotally have talked to some of the kids or their parents who've gotten vaccinated. My kids have their appointments. They weren't the first in line, but their time is coming very soon. But what I'm hearing is mostly just, sore arms and some fatigue. And, that's really what we're hearing so far from the study group as well is, sore arms in a lot of kids. And I know I had a very sore arm when I got all of my shots as well. And then, feelings of fatigue, kind of the mild flu-like symptoms. Let me see if I wrote down a few of the other ones. Well, that's really it. Like, yeah, a headache could be something that we're hearing, but really in general, the kids tend to have less side effects than the adults as far as those more adverse events.
And Nurse Lindsay, I didn't know that, so that's really good to know, especially with our school age kids, and we're going to work, and it's like, all right, so we get our children the first shot. What can we expect? Are they going to have to take a day off of school? Am I going to miss work? And so hearing these stories, I think is really powerful and important.
Yeah, definitely. And Marwan, that's a good point. So Kitsap Public Health, we're having our first pediatric vaccination clinic this Friday at St. Michael's in Bremerton, the old St. Michael's Hospital. That's our primary site, and we've strategically decided to have that clinic on a Friday evening from 3 to 6, and we have them scheduled out for the month of November. We're going to discuss how long we'll be continuing those, but and then I know Bainbridge Island, they have a large clinic in Commodore they ran last weekend, and they have this upcoming weekend, and they strategically make that on the weekend. So you really can't go wrong with your appointment time. But if you are worried about your child having, increased fatigue or headache or anything.
Your audio.
Apologize for that.
Oh, it's okay. If there's anything you might anticipate that, planning that with a day off to rest and lay low the next day isn't a bad idea.
Yeah, no, absolutely. And so far, anecdotally from what you've heard is, just kind of the soreness in the arm, a little tiredness, which, means you kind of get a little bit of a break, right? and a slight headache. So what were the ages of the folks that you've kind of heard back from, of the kids that were vaccinated?
Yeah, so I'm hearing back from kids age 5, really 5 to 11, to be honest. A 10-and-a-half-year-old is the oldest one that I know that got vaccinated over the weekend. But yeah, largely not, I'm not hearing any severe side effects at this point. So.
And I don't know if you know the answer to this question, because as you speak, things kind of come into my head. Kids that are older, they can articulate a lot, easier what they're feeling, right? It may be a little bit more difficult for a 5-year-old. So you're just kind of looking for malaise, or, mommy, daddy, my head hurts, or, my arm hurts. At 5, they should be able to tell you that. Or are there any, kind of nonverbal things that parents can kind of look out for as, oh, okay, my kid's not feeling too hot, just keep an eye on it?
Yeah, definitely. Kids will tend to touch or hold an area that's bothering them more. Just they'll act more run down, less energetic, maybe laying around. And another thing is just they often a little more grouchy. So if their mood is off, it could be related to that feeling extra tired or being in pain or discomfort. Gotcha. They might not be able to verbalize.
And if you could, would you share with everyone again, the dosing is the same as the adult, but it's just the third, and is the time frame the same in between the first shot and the second? Can you just go over that again for folks?
Yeah, good questions. So it is the same vaccine. We get separate vials because we want to, safety is our primary concern with giving the vaccine, and safe and effective. That's the top of the line. And we want to make sure that we're giving your child the pediatric dose, not an adult dose. So separate vial, same vaccine, and they are getting a third of the dose. That's correct. So an adult's getting 30 microgram dose for Pfizer, and that child's getting a 10 microgram dose. So as far as the spacing of the vaccine, that's still at 21 days. And that's what Pfizer is currently recommending, 21 days between the first and second dose. And that's what the pediatric kid vaccine from 5 to 11 is as well. So 3 weeks out.
All right. And do they make the second appointment? So if they come to St. Michael's on Friday and they get their first dose, is that a second appointment made then?
Yeah, so at St. Michael's and with the health district, we're in the process of perfecting that process. Since it's our first clinic, we are anticipating being able to make that second appointment because we want to make sure that those children get fully vaccinated. I don't know from place to place. It sounds like Bainbridge Preparers is doing the same thing. They're making that second appointment. And somebody to remember, so I've mentioned the St. Michael's with the health district and this large site out on Bainbridge, but really we rely heavily on pediatricians and family practice doctors, as well as pharmacies in the community. They've already received shipments of vaccine. And so before even trying to get a spot at one of these larger sites, which are quite full, and the Friday appointments are already full for us at the health district, I recommend calling your pediatrician or your family practice to try to get that appointment. And that's also a good alternative if you want, like a private room where, if you're really worried about how your child's going to be with a needle, and you have a good relationship with your pediatrician or family practice doctor, that could be a good idea. But they definitely could make follow-up appointments there, just as you would for any childhood immunization.
Yeah, absolutely. And, I would assume that the process is probably similar to when I was vaccinated at the Marvin Williams Center. And so I'll put a link later on in this post, because I actually vlogged about it. So I wanted people to kind of see what that experience is like, getting in line and getting the paperwork and, okay, you go to this stage, ask these questions, you fill this out. Okay, this is what this looks like. You wait 15 minutes after just to make sure everything is good, and then you can go. So, a lot of times it's, the fear of the unknown. So as much as you can uncover that for folks and just make it a little bit easier, it's like, okay, yeah, that's not what I thought it was. This is a whole lot simpler and pretty easy. It may encourage folks to get their vaccination. As always, if you are in need of vaccine, we are offering free transportation from Gather Together, Grow Together. So you can give us a call at 360-373-3000. And we will get you to where you need to go in the county. And as Nurse Lindsay was saying, as the vaccine is available for kids throughout the county at, I would assume, Walmarts and Safeways and places like that, you might, just double up and get your shopping done at the same time. So, make good use of your time. So we want to encourage and help you through that. Sounds like, there might even be opportunities for families to get vaccinated together at this point now, right?
I will say that going through a provider at this point or pharmacy, that you should be able at select pharmacies and providers, that you should be able to find those kind of appointments. Yeah, absolutely. A good idea, especially if you were one that were waiting for the pediatric doses to be approved so that you and your child could get your shot at the same time. I'm just giving you a couple things in the chat here, Marwan, that kcow.us/vaccine. That is where you can go to find any updates about pediatric vaccines through the Kitsap Public Health District. And there is a provider hyperlink there if you want to see a list of providers on a PDF who are offering vaccine in our community. And another spot you can go, and I'm putting that in the chat right now, is vaccinelocator.boh.wa.gov. And that's where you can go to find any vaccine appointment, whether pediatric or adult. And that's a good resource to have statewide.
Well, let me go and put both of those in the chat. And I'm a big proponent of showing people. So I'm going to go ahead and pull this website up so people can see what you've shared with me, because I think that makes things a lot easier and less scary also. So this is, can you see that, Nurse Lindsay?
Yeah.
All right. So you can see the patient appointment scheduling here. There's an online doctor consultation and online appointment scheduling. Get the COVID vaccine and COVID-19 testing. And so if you want to just navigate me through this, where should we go here?
So kind of more in line with what we're talking about today, the patient appointment scheduling is where you can click for that.
All right.
That's it.
We won't make an appointment today, everyone.
Yeah.
We'll take up a slot for someone. But we do, again, if you can see it, it's like, yes, I'm in the right place. Like, this gray and the designs on the left and the right. I haven't seen a web page like this. Am I in the right spot? Like, yeah, you're in the right spot. You're doing good. So free online appointment scheduling software, Calendly. Is that how you say that?
Yeah, I guess it is.
Must be an app. Like, okay, that's a tongue twister. secure on-call scheduling on the go, simple online booking, and if you need help, you can also click here, which is also very important. And so we can visit the website here. Is that what you would
Yeah,
recommend?
let's go to that, visit the website, that top link.
All right. And so here we are at Calendly. Easy scheduling ahead. And it says you can sign up by putting in your email, but is that where we go?
You know, Marwan, it looks like it took us somewhere different.
Let me
I'm
go back.
not, yeah.
So, we're going to have a Kitsap Regional Library come on and kind of teach us about how to, get really good information and kind of cut through the noise. And some of that is also navigating. So just FYI, when I clicked on that link, it opened up in a new tab. So a lot of times we're like, where was I? You can close that tab and you'll be back where you were. So let's try again. Maybe this one down, secure online scheduling.
Yeah. And you went to did you go to kcow.us/vaccine? Is that where we started out at? Okay. Okay. Yeah. Let's try that one. Sometimes it's a little bit of trial and error, to be honest.
And this one has the on-call scheduling.
Yeah. Well, and if this is failing, then I recommend go to that vaccinelocator.doh.wa.gov, that second link that I put in the chat.
Yep, let me grab that one there. And see, that's good. That's why I like kind of going through this and stuff.
Troubleshoot in real time. Yeah.
Well, we don't want folks to give up and say, well, I went, it didn't work. And, all right. So this is the second link, which is the vaccinator, doh.wa.gov. We just put that here so we know where we're at. And you can find appointments. So all I need to do is just type in the zip code. So I'll type in 98337. A lot of folks live around the college. And what comes up is we see Peninsula Community Health, which is the Gateway Center down on 2525 6th Street in Bremerton. And they have the Pfizer, ages 12 and up. Appointments are available. So you can go to the website or look at more scheduling options. Scrolling down, you can see the Manette, which is 100 Wheaton Way, Suite F and G in Bremerton. They have the Moderna, and appointments are available. And this was updated 5 days ago, so I'm assuming they'll probably update it every week. Former St. Michael Medical Center, Bremerton, operates by Kitsap Public Health. Shout out to Kitsap Public Health and everyone there. And they have the J&J. They have the Moderna, the Pfizer. They have everything. And so they have the pediatric from 5 to 11, as Nurse Lindsay was saying. And so that's awesome. And there are appointments available. And this was updated 7 hours ago. So that's why she's giving you the latest and greatest information. SARS Super Saver Store. And this is where I got tested. So when I got sick and I thought I had COVID, I went there to get my test because it was close and convenient. So they have the J&J, the Moderna, and the Pfizer. And they do have appointments available. You have Walgreens, and I won't read them all, but there's quite a bit. So if you're looking for a place that's close to you, go ahead and check it out. And as I said before, if you are in need of transportation, or you're like, you know what, I want to go ahead and focus on my child, will they get the vaccine because it's a needle? You could leave the driving to us, and maybe you go to Walmart and get some shopping done at the same time. So, go ahead and take advantage of that. But this is really super easy to use. And I will click on, just let's say here in Bremerton, we can go to the website, and this will give you the information. Keep your account safe by clicking the character below. And it will give you a phone number. So it's just going to take you to the organization's website, so you can give them a call if you want to get more information and go ahead and set up your appointment. So that's really awesome. What do you think about that, Nurse Lindsay? Is there anything that I left out there you wanted to add?
Yeah, no, I think that's all great, Marwan. I would also add, Kitsap Public Health, in addition to us offering vaccine, we really try to promote these other venues where you can get vaccinated. So if you follow Kitsap Public Health District on Facebook or Instagram, our social media moderator updates almost daily with a post about where you can find your vaccine and different sources. So if you're a social media person, I highly recommend getting on there. And sometimes I think that they blast stuff out before I even know it. So it's a good way to stay up to date as well.
No, I love that you guys are using all the tools. And while we're talking about, social media, just the Kitsap Public Health District's website here, and we looked at this last week when Holly came on, and I think it's a good idea to kind of take a look at this. But if you just type that into your URL, which is kitsappublichealth.org, and I'll put that in the chat also, so folks have it. You will come up and you will see all the information about Kitsap Public Health. And this isn't just about the vaccine, but you'll get a little bit of everything here. And whoops.
I think go to the home link up at the top on
Yep.
the left. There you go. That works.
There we go. All right. I say I'm on here for more than just the vaccine. So
Yeah.
And then if you scroll to the bottom we've got to click on the resources, right? COVID-19 updates.
Right in the middle of the page. Yep, that's it.
And then we can scroll down, and then you've got your data dashboards, vaccine updates, getting tested. If you want to look at the reopening plan, guidance for businesses and organizations, which is one that I look at, youth in schools, which is important for all the kiddos, and that's what we're talking about today. Current outbreak information, healthcare resources, who to notify in Washington, and then contact tracing. And then if you scroll here to the bottom, maybe I'm going too fast. Is there something that you wanted to point out, Nurse Lindsay? Because I was just going to go down to the graph there.
Yeah, I think the only thing I would point out is at the top, before you hit that data dashboard, there's a phone number to call if you do have a positive home test to report.
Right here, 800-525-0127 to report a positive over-the-counter test result. So that is very helpful to everyone, right? If you do report, if you have a positive test, for sure. Thank you for that. We missed that last week, so that's awesome. And then I'll just scroll down slowly in case you see something you could tell me to stop there. The vaccine boosters, those doses are now available for all 3 COVID-19 vaccines, but not everyone is eligible to receive your booster at this time. Use the flow chart to find out if the booster is recommended for you. I got my flu shot on Friday. I didn't want to get my my flu and my COVID booster on the same day. Both shoulders, and I was like, all right, I'll do the flu shot first, and then I'll come back because I had an event that I needed to go to on Friday. And I didn't want to have any side effects at all. I don't want to feel tired or anything. It's like, I'll get the flu shot this time. And then, next week I'll go ahead and get my booster. So I'm gonna get my booster this week.
Good work.
And then I'm gonna scroll down to the data. Will you just update us on the data? How do we interpret this here? Is it up? Is it down?
Yeah, sure. So let's see. Are you able to scroll down just a little bit here?
Sure.
Yeah. So you can see the graph here in the middle, where you've got the peaks and the valleys going on, and you can see there that we are a little bit not a little bit, really. From September, we're a significant downtrend. So we're still up to around where we were last winter, and we're only coming into the winter as far as our cases. So we're still in that high transmission for cases, but we are on a downtrend as far as the county goes. So it is, this is useful just for looking at the overall outlook of what's going on as far as the cases, and seeing like a number on the deaths there at the bottom. So there's this is a good snapshot if you're just having a quick look at the health district site.
So Nurse Lindsay, you said something that was pretty profound, right? We're looking at the graph and you see like August, September, like September looks like, whoa, right? I mean, that is the highest since February of 2020, right? And is this graph tracking COVID period? Like the lifespan of COVID?
Yeah, so this graph, the one with the peaks and the valleys, this is the cases. and the cases in 7 days. And it's from when we started tracking COVID back in February of 2020 through now. And yeah, there was in the months of August, September, and October, there was more deaths in our county in those 3 months than during the entire rest of the pandemic. So, this is accurate. And so, it's just that. So I would just add that the deaths and hospitalizations do lag the cases. So when we see those cases climb, that is concerning. I think in that phone number, I must have left off a 0. I'm sorry, Marwan. It's a 360-728-2218.
All right, I got it there. I got
Yeah,
that.
so that's actually our Spanish line, and then 2219 is for English. And that's you had asked, I think, in one of your list of questions, just is there a number, if you've got a burning question about COVID or the vaccines, who can you call at the health district? And that's a number you can call. And sometimes you will be greeted by a live person. More often than not, it's an answering service, but we do go through those messages one by one, and we answer them to our best of our ability.
Yeah, I think that's really awesome. Like, yeah, you don't have to wait for Nurse Lindsay or Holly or Dr. Gibb to come on next week. You can get your answers right now. But we want to come to you and not just always wait for you to come to us. So trying to be more accessible in that way. Nurse Lindsay, if we go back to that graph, just thinking about it, it's when you hear so much, like you're living in it, right? We're in the fishbowl, and looking at that graph is like jarring, considering the uncertainty that we went through when COVID first struck, when the deaths. I remember when pretty much all the news channels had the growing ticker every day of COVID, and it was like 1,000 deaths per day, across the country, and it was so alarming. And then you look at August, September, and October, and you're like, whoa, right? I mean, this looks like the Titanic iceberg versus a little tiny hill, from comparatively. And then we think about, or at least I'm thinking about, what the experience was last winter with COVID, and how things were, and it was higher then. And even though we're on the downturn, we're we're experiencing the exact same thing. So what should our mindset be right now? Should we be feeling like, oh yeah, more people are vaccinated, which was more than last year, so we should be feeling comfortable? Like how do I interpret this, looking at it as a person?
It's tough to give you a solid answer, because some of it really comes down to what your individual risk tolerance is. So for someone who's immunocompromised, they might have a much lower risk tolerance. They may not feel comfortable, nor should they, going into crowded places where they might be more exposed. And even if they have been vaccinated, they would need to question, well, have I got my third dose? Is my immunity boosted up? Am I wearing a mask? Am I doing these mitigation measures? But one thing going into this winter is we do have the vaccine, and we didn't have that going into last winter. So we have that layered approach. We know more about how the virus is transmitted. We know it's in the air. We know it's not so much on the surfaces. So just sanitizing everything, while that does keep other illnesses down and is nice and clean, it's not a mitigation measure that's the highest concern. We know we know that if we're exposed, what to do. And it's really ultimately it's a risk benefit analysis is how we have to look at this. And I'm not of the framework of a mind that we're going to totally do away with all cases, but we want to protect ourselves the best we can. So doing those things before you make that call to go to the event or to travel, you want to look into, like, what can I do to best protect myself before I hit the airlines and before I go into this large group gathering or this concert or whatnot. So make sure you're vaccinated. If you're eligible, get the booster shot. If it's been 6 months for the Pfizer or Moderna, or 2 months for the J&J, and you hit that eligible category. If you are sick, get tested and stay away from friends and especially vulnerable. Do your quarantine and contact trace. Let people know, hey, I was around you, I'm sick, because we want to stop that spread. Wear a mask. keep things outdoor or with good airflow, open the windows if possible. And if you can keep your gatherings to folks who are vaccinated, you're safer than if you're just going around where you're really unsure about that kind of thing. So there's more we can do to continue to live our lives in a safe way. But everything we do does have some risk. So that's when you really got to consider what your individual risk factors are. Because everything we do the minute we leave our house is putting us at some risk still.
So Nurse Lindsay, you had suggested if someone gets sick, they should get tested. So, unfortunately, COVID, the cold, the flu, all these things can present as the same thing. And so if you or your kids are feeling under the weather, the recommendation is to go ahead and get a COVID test and rule that out.
Absolutely. Yeah. If you've got any of the symptoms, and unfortunately COVID symptoms they can present as a variety of things. For one person, they might have more headache and sniffles or like a chest cold, and the other person might have nausea and vomiting. So if you do have any symptoms or even like that loss of taste or smell, just get tested to be safe. And that way, if it's a common cold, is it something you just need to mask up and do your due diligence, or do you need to kind of go ahead and lock down, quarantine, and let everyone know who you've been around? So it is really helpful, not only for your immediate loved ones, but just to stop that chain of transmission in the community.
And so, talking about practicality, if someone kind of feels like they're under the weather or they have some symptoms, they're not going to shut everything down immediately, right? You're going to try to schedule a test, but are you going to, I got to send the kids to school or I have to go to work. So is it during that time where you're trying to get in to get a test and wait for the results, is just to be as diligent as you can as far as washing your hands and wearing a mask, and you don't wear a mask at home with your family because you're inside, but maybe you might consider doing that until you get the results back? Should you tell folks that you've been around, like, hey, my kid's been complaining about a headache or has a slight fever, you might want to we got a COVID test, but we got to wait for the results. So you might just want to, isolate or just be wary, because you don't want to be an alarmist. But so what's it seems like it's a difficult way to navigate that. What
it is a difficult way to navigate that. But especially if you've had close contacts in those 2 days prior to becoming symptomatic, to developing your symptoms, that's when you would have been infectious. So I recommend if you wake up in the morning and you realize you're quite ill, you're not feeling good, take a COVID test and let those folks who you've been around the last 2 days know. Say, hey, I'm having symptoms, I'm waiting on a test, I'm going to let you know as soon as it comes back. And that way they're able to make their decision and they're able to keep an eye on their own body to see what they're developing. But that is the prudent thing to do. And I think that's the responsible thing to do. And I know that I would appreciate that if a friend of mine told me, although I'd be like, oh no. But
I don't want to be the my head in the sand. I'd rather be empowered to make a decision and kind of try to mitigate that or do what I need to do. If nothing else, it kind of lets you know, because I think this has been going on for so long now, we're do well, and then all of a sudden our guard starts to lax a little bit, right? I was at a restaurant the other day, and you have to take your mask off to eat, and then you're not eating or drinking, and you're just kind of sitting there, and it's like, well, maybe you probably ought to pop the mask on, and maybe you should get out of there. It's like you came, you had the dinner experience, now go. Because this is still a big deal. And again, here, just to show on the graph, if you're looking, everyone, at the moderate, substantial, and high, while the numbers are coming down, we look like, if I zoom in, I can't really zoom in here, but it looks like we're still technically in the high, right?
We are. Yeah, we're still in that high transmission for Kitsap County. So it's still out there very much. And I'm guessing that a lot of people listening have known someone recently who has come down with COVID or had an exposure. So it's out there quite a lot. So it's best to just assume it's out there. And you're right, not to put our head in the sand, but to go about this with as much information as we possibly can. Because knowledge really is power in making the right decision for yourself.
And here on the graph, Nurse Lindsay, it says cases and deaths current as of 11/7, 2021. And so are these all the deaths in Kitsap County, the 237?
Yes, that's our current death toll since the start of the pandemic.
Gotcha. Okay.
Mm-hmm. And there's a bit of a lag, so I can assure you it's higher than that, because by the time the death occurs, and then it has to get sent to it has to go through our Gib Morrow, our health officer, Dr. Gibb, and then it gets to our epidemiologist team that updates this. So again, there's a bit of a lag for a lot of reasons, because each death is investigated. Make sure that they're not calling it COVID if it's something else, or vice versa.
And if I'm not mistaken, this is updated every.
Well, I am going to be honest with you, Marwan. I don't know exactly. This one, I believe, at least as far as the daily portion. So the thing with this shot that you have up is there's a lot of different things going on. So I don't believe that each portion of it is updated at the same date.
Oh, gotcha. Okay.
There's some variability in it. Yeah, some of these infographics are updated daily, but some are not. We just don't have the ability for that for a variety of reasons.
Yeah, I think Holly was saying it's either Monday or Wednesday. So either we missed it or was
and to be honest with you, I initially in the pandemic I used this tool to look at, but where I like to look for my information now is back on that data dashboard. I'm able to pull out, if you scroll up, I think if you go way up past what you're looking at here, and if you're here on these data, if you click on the data dashboard on the left, that icon, and this, in my mind, is a bit easier to track, and I can pull exactly what data I want. So if you are specifically interested in those hospitalizations and deaths, you click on the view dashboard. I see it's updated on Thursdays. And it's just a more, it's as if we're taking a zoomed in view of that other chart and able to really pull out those numbers a bit more and say, well, of the hospitalizations, who received their vaccine, who didn't, what are the percentages by months, all of that information. So if you're kind of an information junkie and like to really dig into it, these data dashboards are where you're going to want to spend your time.
So just while we're here, hospitalization rate per 100,000 per vaccination status. And again, this is Kitsap County, correct?
That's right.
And here it says for the past month, those that were from 12 to 59 years of age, if you were fully vaccinated, it was 1.7 versus unvaccinated 19.9, correct?
Mm-hmm. Yep.
Per 100,000.
I know this is just simply the numbers. So this is more than just putting it in large scale 100,000 numbers. Like this is real numbers.
Oh, real? Oh, okay. So that's even. Oh, I love this. And so ages 60 or over, vaccinated. If they were fully vaccinated, 8.8 people were in the hospital versus 34 people, almost 35 that were unvaccinated that made it in the hospital. So we're talking about what is that? 4 times the amount if you were unvaccinated that you're likely to be hospitalized, or if you're fully vaccinated, if you're age 60 or above. If you're below that, it's 1.7 to 20. So we're talking about what is that? A 2 in 10, or 1 in 20, 2 in 10. That's huge, right?
Right. So it just shows, because we hear a lot, about breakthrough cases, and it's true that there is some risk even as a vaccinated, especially in a county of high transmission. Your vaccine only protects a certain percentage, and really the best, you're up in the 90s. So there's still that 10% chance if it's highly transmitted and you have a really good or bad exposure, you're going to get it. So it just shows that you're that much more protected if you get vaccinated. So it's, I find it reassuring with the choice to get vaccinated, although also quite sad, because all these represent numbers of people who are oftentimes fighting for their lives or losing their lives.
Right. Right. Absolutely. I got to give you guys a horn for this graph right here. I think this is really powerful, and there's so much information out there, and people get their information from different places. But these are the real numbers, folks, here in the county. So if you're fully vaccinated over the last month, 1.7 folks from 12 to 59 ended up being hospitalized, even if they were vaccinated. We're talking about 2 people versus if they're unvaccinated, 20 people. So that is phenomenally that's a huge chasm there. And again, the same with folks that are age 60 and over, if they're fully vaccinated versus if they're unvaccinated. So it really is something to look at. Again, when you're trying to figure out where's the real information, you want to make an informed decision for yourself. This helps me to make an informed decision, and it helps to reinforce the fact that, yeah, I definitely made the right decision. Now, does it mean that because I was vaccinated, I'm not going to end up being hospitalized if I do get a breakthrough case? No, but it says that if I do uh, get COVID, it is far less likely that I end up hospitalized because of it. So that definitely lets me know that I made the right choice 100 out of 100 times. So, man, I will sleep well tonight for sure. And then looking here, the percent of cases hospitalized per month, if you just look at the whole lifespan of COVID here, if you look at October, which was just a few days ago, is 7%. Well, it's never been that high until you go all the way back to August of last year. So, yes, the numbers are coming down, but it's something to be aware of also, right? Yeah, I think this is really powerful information. Thank you for walking us through that, Nurse Lindsay.
Yeah, I'm happy to help. I find this really, really helpful
Yeah.
just to get a picture of what's going on. And our team does a great job of keeping this updated. And yeah, this is the one that's updated every Thursday.
And this one's updated every Thursday. Again, really easy to get to. And of course, as we come on every week, we'll share this information with you. Just because, hey, you're busy, you haven't had a chance to go and look at what the real numbers are, right? You're seeing all the stuff in the news. Is this local to Kitsap County? Is it local to the city? Is this national? Is it international? Who knows what it is? That's why we're here to kind of share this information. Nurse Lindsay, our time is coming to an end. I did want to just talk a little bit about international COVID now that they are reopening travel into the United States, and just letting folks know that, we've got Thanksgiving coming up in about 2 weeks. We have Christmas coming up right after that, and New Year's. And as we see the local numbers, right? Yes, they're going down, but yes, we're still in the high. We still must be careful and diligent. And now we're going to introduce people from outside of countries coming in, and just kind of share that information and kind of get your thoughts on the other side of this. Is that okay?
Yeah, that sounds great.
All right, so let's go ahead and play this video. Fair use. Always need to say that. Let me go ahead and put up my copyright disclaimer there. And this is this morning's top headlines from NBC News Now. So let's go ahead and give that a quick listen here. It's a really short video here.
We begin with a day people around the world have been waiting more than a year and a half for.
Yeah, the United States now back open to travelers from 33.
I'm going to go ahead and pause that. I consume a lot of information, so I have to listen to it quite a bit faster than normal folks.
Countries, but they have to be fully vaccinated. It's the first time the U.S. has opened its borders to so much of the world since March of 2020. Under the new rules, in order to enter the U.S., foreign travelers must show proof of vaccination and the results of a negative COVID test taken within 3 days of traveling. The lifting of this travel ban comes as COVID cases have dropped here in the U.S. since the Delta surge, but cases are back on the rise in some parts of the world, including Europe, where some countries are now reporting record outbreaks. On a positive note, though, more than half of the world's population has now received at least one dose of a COVID vaccine. That's more than 4 billion people. We have a team covering this major day for travelers, reuniting with family and friends. NBC News correspondent Rahema Ellis is out at New York's JFK Airport. NBC News foreign correspondent Matt Bradley is in London. So, Rahema, let me start with you. Who is now allowed to enter the U.S.? What do they need to know before they get on that flight?
Yeah, first thing, good morning to both of you. It is a good news for many international travelers. As you point out, that travel ban has been lifted, but there are some restrictions, as you mentioned. I want to put up on the screen, full screen, so people can see this, so we can show as well as tell them. First and foremost, all adults must be vaccinated, must have a negative COVID-19 test within 72 hours of their flight. Children under 18 don't need a vaccine, but they must have a negative COVID test, and kids younger than 2 are exempt from testing. Now, this is something that travelers need to absolutely be aware of before they head to the airport, because without following some of these protocols, it'll be very hard, if not impossible, to get on that international flight. Kate?
And now, Matt, this is the first time that most travelers in the UK have been able to come to the US since March 2020. So, I mean, are people rushing to do so to get to the other side of the pond? What are people leaving today telling you?
That's right. 602 days exactly since the last time that there was free travel into the United States. And apparently at Heathrow, there were, people were waving American flags. It was a very emotional scene. We even spoke with one couple who said that they were going to the U.S. to meet their daughter's fiance for the first time. So it was actually a really emotional experience there at Heathrow. But I'll let you guys listen to them yourself.
I'm gonna pause it there. They were very, very excited to be able to travel back into the United States, as they were going to meet their daughter's fiance for the first time. But with that excitement, you're going to have this influx of folks, 33 different countries now flying into the United States, and we're still in a high status, and higher than we were at the same rates, or very similar as we were last winter. Without the vaccine. So something to be very cognizant of, especially if you are accepting these visitors into your home as they come in, or if you're at events, concerts or sporting events or out to dinner or whatever, these folks are going to be there. And it's just, you need to remain diligent. What are your thoughts on Nurse Lindsay? How do you interpret just this news here?
I feel a mix of excitement as well as apprehension hearing this news, because I want the world to get back to normal. I want commerce open, travel open, all of that. But at the same time, we've seen the devastation of the past year and a half of what COVID has done, as far as lives lost and long COVID and all of the rest. So, I'll say that I agree. It's time to layer up that approach. And if the guard has been down, maybe time to bring the guard up just a bit. And there's things you can do to help protect yourself more, knowing that more people coming in, even though they are taking these protocols of negative tests and vaccinated adults, these children 2 and under could still bring something. They're not testing for it. There's still, even though you have a negative test, you could catch something before you hit your flight. And there's some, testing isn't always absolutely 100% if it doesn't pick up on something, if you're in that pre-symptomatic phase and you are someone who develops symptoms a few days later. So, now's the time to get your booster shot if you're eligible, get vaccinated if you have not yet, and get your kids vaccinated if they are eligible. It's time to put a mask on, and it's time to be cautious. For instance, my family is going to be flying for the first time in December since 2020, hit. And so we're taking approaches like we're getting the kids vaccinated. I got my booster. My husband's not eligible yet, but he'll be getting it as soon as he does. His parents that we're going to visit, they're going to be getting their booster before we come out. And we've already kind of tried to lay out a precedent of, we're okay with a couple of small gatherings, but let's make sure that everyone who shows up is vaccinated. If we're going to go out to dinner or we're going to go ice skating or something, we're going to put our mask on. And the whole time we travel, we're going to hydrate before we get on the plane, try to leave those masks on the whole time if we can, just, quick sip of water and back on. I'm one of those people that sanitize down the seat before I get there. But I know that planes, what I'm hearing is that planes are really considered a fairly safe way to travel because of all of the mitigation measures that they're putting in place. But now is the time to bump up that approach if you feel like you've kind of let your guard down and Yeah, I think like just a very big mix of emotions in hearing that, Marwan, as with so much of the news these days.
Yeah, it really is. And I'll share with you, I was in Virginia earlier in the summer for a week, and I was fine, uh there and back, and seemed pretty safe. Wearing my mask on the plane wasn't really a problem. Now, I got COVID when I got back and almost died from it, it seemed like, but the traveling was fine. And my daughter, who wasn't vaccinated, spent a month or so in Alabama with her grandma, and she was fine, on the plane and coming back. But yes, this is going to be an influx of more folks coming over here. The thing for me that is let's say alarming, just concerning, is when I think of just the other variants. Like, we talked a little bit about the Delta Plus variant a couple weeks ago, and how the cases are really, I don't even know if it's here in the States or not, but it's in other areas. To me, it's like that's how these things end up getting here, is someone has to have it and bring it in to our ecosystem in order for it to kind of populate. So it is a concern. I definitely, as the holidays come up, it was really nice going out to dinner. We had dinner. I had dinner at the boat shed on Friday, so it was nice being out and doing that. But there's going to be a lot of other folks that are doing that too. So you just gotta make sure that you're diligent. You take care of yourself and you take care of your family. I don't want to, bring back COVID and get my daughter sick or get someone else sick. So I want to make sure that I'm diligent, but then still able to do the things that I need and want to do, at the same time. So it's just about being responsible and just thinking about, my fellow neighbor and Kitsaptonian. Is that a thing? Kitsaptonian?
It can be now.
Kitsaptonians, that's what it is. So, and just doing that. And I don't mind doing that. So I want everyone to be healthy and thrive and just to, be with their families, which is so important. So, I so enjoy our time together. Is there any last things that you want to say before we end today? Friday at St. Michael's at what time?
I guess it's Friday. Yeah, so we're going to be 3 p.m. to 6 p.m. And now I know the appointments are filled from what I'm hearing. However, if you call that phone number that we put up there, that 360-728-2219, if you're having any difficulty scheduling online, you can call that number and you'll get linked up with someone who can assist you to make an appointment. And even if you can't get in this Friday, they could work on getting you in for the following week, or even help make a referral to a provider who's able to give you and your child a vaccine. So don't feel like you have to be the most tech savvy. Clearly, I know might have had the wrong site or we're clicking on the wrong things, all with the best intentions. But just know that that getting vaccinated is our best approach and that layered approach right now. And I know Marwan and I, we want you to be as safe and healthy as possible this holiday season.
Absolutely. And again, that phone number is on the screen. That's 360-728-2219 for English. And however you reach out, we will make sure that you get into the right space. So if you're calling and you want information or you want to schedule a ride, again, you can call G2 at 360-373-3000. Nurse Lindsay, I really appreciate you this week. I hope you have an eventful week, which is positive and just full of good experiences. And we will see you soon. Sound good?
Hey, thanks, Marwan. Great to see you again. Thanks, everyone.
All right. Well, I'm Marwan Cameron. This is The Conduit. I will see you back here at 3 p.m. for our show with KCR and the Bremerton Housing Authority. All right. This is The Conduit.